President Capilouto, thank you so much for taking the time to sit down with me today.
It's a delight to be with you.
So I want to start with the new program that the university is undertaking called UK Leads. From what I understand, you guys are doing something really interesting and innovative where you've looked at why students end up leaving the institution, and a lot of it has to do with financial need. And so you've been evaluating that and finding a way to fill that gap. So can you tell me more about how you're accomplishing that goal?
Sure, through some what I would call clever analytics in trying to understand more fully why students don't succeed. This is something that certainly popped up on our radar, not a big surprise, but that we could quantify it in this manner. The amount of unmet need someone has is the difference between their grants, scholarships, and loans. That gap, we know if we can shrink that to just $5,000 a year from an average of $7,000, let's say, we can dramatically increase the likelihood of retention into the next year and consequently graduation. We ran some pilot studies to see if this would really work, and it did. It's quite effective. And we've had people contribute to this scholarship program. We're grateful. It's part of the reason I can say that if you look over the last 6 years in Kentucky, of the increases in numbers of graduates from low-income families, the University of Kentucky represents over 70% of all those students compared to the totality of all the four-year colleges in Kentucky. Families with income challenges, we break them into 4 groups from the lowest income group to the highest. They still have much need, but that low income group, that average family income is $19,500. $19,500. So for all of those groups though, the net cost of tuition has gone down, and in fact for those bottom groups, there's a negative cost, meaning they get more in grants and scholarships that you don't have to pay back than the total cost of tuition. And that's what's driving our numbers.
So you bring up that they don't have to pay it back. So that's some of my main questions is you have a lot of students here at the University of Kentucky, so how do you select who is awarded these financial help, and are there any strings attached?
So we have sort of some analytics that we weigh in numerous factors. We don't have unlimited funds, so we certainly want to invest where we think we have the impact. And it's not the only consideration, but it's the primary one. We also, rely on different sources of money. Our own is the fastest growing one that we invest into this. But we have federal and state awards that are based on need. So yes, one has to continue to be successful in school. We also want people to have a higher level of financial wellness. So we have programs where we bring students in and teach them how to better manage their funds, to seriously consider if you're going to take out a loan, what kind of debt that means for you and your family, what it means for a lifetime. We want our students to enter these programs with eyes wide open.
What's the average award that you all have been giving out through this program? Is it around $500? Is it multiple thousands of dollars? What do you feel is the average?
I'm sorry I don't know the exact. It can range from $500 to $1,000, which can make a difference, we now know at the margin, to several $1,000s. So we're able to sort of personalize our interventions.
And people across the state, I assume you said you're fundraising some, so business leaders, people like that are helping with this initiative as well then?
Well, one, just generous in both resources and character, and a model story for our Kentucky students are the late Don Ball and his wife Myra. They met here on the steps of a building at Kentucky. Myra and Don, before his death, discussed this. and she made a gift of $10 million. It supports awards for students from the 2 counties where they respectively grew up. And we had a reception for those students so Myra could meet them, and the stories are deeply moving. As one student said, she couldn't believe when she got the phone call. She seriously considered not coming back for her 2nd year. She called her mother and said, "I'm going to come back, and more importantly, you don't have to get the 3rd job." And those are the kind of stories that move you and have been the basis of the generosity we've realized. And we have much more to do. We have a total, at one time it peaked at $120 million of unmet need across all of our students. We've reduced that down to a sort of a $90 million level, and we want to take it down more because we know it leads to greater student success.
So let's talk about another financial issue. A couple years ago, the state legislature decided to pass something that would give universities performance-based funding. So we've had a couple years now since that passed, and you presented to the legislature in the summer and said that UK has hit 10 of those 11 markers. Other universities haven't hit quite as many. This is going to kind of be a big test in 2020 as we go into a budget year. So how do you feel the model is working so far, and how has UK changed its priorities or funding streams based on this new model?
Well, I was part of the work group. All the university presidents were at the table, along with representatives from the legislature and the executive branch. And we agreed on these metrics. And they largely focus on student success at the undergraduate level, because that's something we share in common across all the 4-year institutions. We have a significant research enterprise, healthcare delivery, service, and so forth, that's not in the equation. But I don't know a great university that doesn't do well in graduating undergrads. So we're fine to have those metrics. And we have been responsive to them. We have taken scores of programs under consideration, launched them, changed them if they're not as successful as we'd like, trying to get more students across that finish line. So I am very proud, because it takes a group effort of all our faculty and staff and even students who contribute to the success we've had. And so yes, 10 out of 11 metrics, 11 out of 11 the year before. I think the next closest university had only 5 of the 11 for which they qualified for some support through the model. And show us the rule book and we're going to play by it. What I also think is important, and this is not just in this case, is when you have this kind of funding formula, it takes a while for a university to align. We're a big organization, 25,000 employees and all, to realign so that you achieve in these areas. It takes time. We started early on this. It's been important before the performance funding model came into place, but you want these to be enduring. If you change course and you start using some other method to award dollars and then you flip back, it loses, I think, its potency to change the culture and the system and the organization to support that. And so I hope we stick with it.
And like you said, most universities aren't doing quite as well meeting the metrics, but it is not going to happen overnight for everyone, obviously.
Yeah, but the law takes into account that people had to adjust. So, we're talking about a few small percentage points of our total funding from the state. Right. Not all the funding.
Which I don't think most people realize. I think most people are very much under the impression that all university funding comes from the state. It's actually a very small dollar amount, right?
It's a small dollar of the state amount.
Right. So do you feel that the formula needs to be tweaked at all in terms of the other regional institutions or anything like that? Have you heard from other university presidents that they'd like to see the model changed at all?
When the state passed the law, there are what I would call look-back provisions. So it's always healthy to pause and take a look and say, what does the model mean? So we're always open to those kinds of discussions.
So like we said, the state dollars are not a big, huge part of your budget, but do you have any concerns with the upcoming budget session? Because Kentucky is facing a lot of huge costs, and I think everybody gets a little nervous every time it comes to a budget session, especially because we talk so much about how we have to prioritize education. I think everyone agrees on that. With all of these big costs, are you concerned at all going into the budget session, even with performance-based funding?
So this represents less than 10% of our budget, but it makes everything else happen. We get a little over $260 million from the state. 80 million of it goes out the door. It's sort of a pass-through to our 120 extension offices in the state and other mandated programs. So it doesn't leave a lot for a comprehensive university that does everything associated with an academic health center and the expensive education of health professionals to the full array of undergraduate, graduate, PhD type programs, master's degrees as well. So we try to be prudent. We really respect the state, our General Assembly, executive branches, because we know there are no easy choices. So we go to make our case. We've appreciated that our case is taken seriously. There have always been adjustments upwards from what the original proposal may be, but we're still a state that overall has not restored the funding to higher education. My respect for state legislators grows because every time I meet with them, I see their struggles with difficult decisions. They're trying to do the right things, and look at the other things that are draws on our money. Medicaid or health insurance, K through 12 education, the pension challenges we face. So, those make for difficult choices. I do hope dollars bounce back that can be made available because we put them to good use. I mean, you get the $267 million, we pay over $100 million in state and local taxes after we take that $267 million and translate it into a $4.2 billion budget. When you look at our research, that's extramural funding. Most of it comes from out of the state. That economic impact is over $700 million. So imagine the jobs we create. So we think we're a great investment. If the investment were made greater, there'd be even greater returns.
So workforce is a huge concern of Kentucky businesses across the state. And there's been a shift in recent years of people saying we need to focus on technical skills, technical degrees, rather than four-year institutions, especially for some individuals. So what is UK doing to make sure that they are graduating people that have the skills that are necessary and needed by Kentucky businesses to keep the people in the state and ensure that they have the skills that Kentucky businesses want?
Yeah, great question. First of all, we're graduating more students. Last year alone, over 7,000. And I think the college degree is still a ticket, a passport to a purposeful, meaningful life. But what we know today is the acceleration of change, technology, discoveries mean that you got to be able to continue in your education once you leave here. So that degree, I think most people recognize today, unlike when I graduated from college, the likelihood you're going to work for one or two employers is pretty dim. What we do know is there are jobs today we don't even know about yet for which our students have to be ready. I think paraphrase what others have said, a four-year degree doesn't necessarily prepare you for your first job, which could be more technically focused, and that's a certain level of preparation. But we got to prepare you for your fifth job, where critical thinking, communication skills, working in teams, those kinds of competencies and qualities matter even more. So I do think the experience we can provide, rich in not only classroom, laboratory experience, but experiential learning, internships, co-ops, study away. Things that sort of broaden the breadth and depth of your knowledge and experiences still make it a very worthwhile investment.
Are we still, as a state, and is the university as focused on STEM degrees as we have been in the past? You know, the conversation has usually been liberal arts degrees aren't going to get you anywhere. We need to focus on these types of degrees. But is that still the case, especially with this conversation about workforce and technical skills?
Well, it does matter to the state, matters to many states. Those are important jobs for which we need to prepare a good number of students. We have had dramatic increases in our STEM and health graduates, but I want to tell people that their education goes beyond, mathematics, science, engineering. A four-year college degree gives you entree into a rich liberal arts curriculum, which I think if you look at recent studies, people say in the long term that set of disciplines, majors, minors, that people round off their STEM degrees with make you even better prepared for those jobs of the future we don't even know about and those high-paying jobs today. So I don't look at it as either or, you either STEM or something else. I find, for instance, STEM, which includes engineering, engineers go into a variety of professions beyond traditional engineering, for which the skill set they've developed best prepares them. So I think it's still important to keep your focus, but keep in mind we provide a holistic or well-rounded education for those students.
Now I want to talk about the opioid crisis within the state of Kentucky. The University of Kentucky is doing some great work, and you guys have received national money. I believe it's $87 million to do work on this, to find new strategies to reduce overdose deaths. And I believe your goal is 40% reduction in 3 years. How do you guys, that's a big goal. How do you guys plan on achieving that?
First, I've got to be grateful to our faculty. That's not the only award we've gotten. We had them before, and we're getting even more. And why? We developed this as a strategic priority. We can't do everything here, but you need to invest in talent and infrastructure. Most of our priorities relate to Kentucky's health challenges, but we also invest in energy and other areas that are important to Kentucky. So we have talent, infrastructure. We had 20 faculty from 6 different colleges work around the clock for 90 days to produce a 600-page proposal. It was deemed by the NIH director who visited here a few weeks ago with the Secretary of Health as the best proposal in the country. So I'm very proud of what we achieved. But I also have to tip my hat to our other partners. State government was very, very important. And then local government, non-governmental organizations. So we have 180 other partners that are part of this. So we're going into the hardest hit communities, and this is still research. It's not purely treatment, because we need to find out what works, what can turn these numbers around. So we're using a variety of interventions, working within the entire ecosystem within a county, adapting to what different challenges you may have there. So it's treatment, and you got to go to where people are. There's still, unfortunately, too much sort of stigma and shame around this. It's not as if you can just put out a sign and people are going to show up. So we have to go to the places where people are going to come to. We have to get to where they are to make treatment available. We know that there are means once you can do that, that would be effective. So we've got to work within our health system, health delivery system, physician offices, emergency departments, and also our justice system, court, criminal justice, the law enforcement. You got to break those cycles in there. You got to intervene. So we have some sophisticated interventions that we'll do in partnership with people at the local level, and I'm confident we can turn these numbers around. We must. And I always like to say, I feel a responsibility to mention, this is not a failure of character or moral judgment. It is a chronic disease. Many people introduced to this quite innocently, a simple prescription with too many doses taken for too many days, introduce someone to chemical changes in the brain that have you battling this for life.
And those are very good points. I do think it takes a community to fix this problem. And a lot of times I feel like people feel like everybody's just talking about it. You know, we're just saying we're going to fix it and we're going to do this and that. But those are good bullet points of exactly what you all are planning to do. So how far into the work are you all currently? And, you know, what does it look like over the next years?
It's a 4-year grant. Every community and county that is participating at some point will receive the full intervention. But as part of any study, you start early so that you can, with a handful, you can't do everybody all at one time. You implement, you see what the numbers look like before you're intervened. You look at what they look like over time. You compare that to the communities that didn't have it immediately, and then what they're going to look like over time as the intervention is introduced. So it's a 4-year award, and we'll be sharing numbers, and we also, there are 3 other states that are participating, and the way the study is designed, you'll be able to combine results from those different studies and get a deeper understanding of what works and what doesn't work.
And finally, I want to ask you about any other initiatives like UK Leads, like this research on opioids that University of Kentucky is currently undertaking that you want to highlight or that you want people to understand.
Well, you name it, we're doing it. You look across our major industries, and I know immediately what would come to mind are horses and bourbon. And so we have a Gluck Equine Research Center, and that one has a long history of critical interventions in a timely way when that industry was threatened. The health of the horse to the health of the jockey. We've cracked mysteries in that area that we're able to preserve that industry. And if you look at the bourbon industry today, which is just expanding, and in all these cases, we've had investments and support from industry partners. But take bourbon today. I think anybody who spent time in Kentucky knows how important that oak barrel is to the production. I've told people that my first year here, I visited the Robinson Forest, and in one of the cabins there, they had an old tree census, and there were a good number of American chestnut trees. Well, I think they're nearly extinct in Kentucky now. Disease and all affected that population. And I think it spread across the United States. Fascinating story about how disease spread. Well, what if that happened to oak trees in Kentucky? Where would we be? So we have work we're doing in mapping genome of oak trees. It's fascinating how the production of bourbon, for instance, produces a waste product. We used to be able to manage it because it would be used in animal feed. Well, now, since we produce more, we have more than can be used in that particular area, but you've got to environmentally dispense that. How do we do it? How do we turn it into other byproducts that are important? We're doing research in that area. In energy, carbon capture technologies that could make the use of fossil fuel energy sources much safer in terms of the environment. Rare earth elements. All your cell phones, most of the technology we use today, critical in our defense industry and all the technology we rely on. Well, I think the vast majority of those rare earth elements exist in China. And strategically, we need to have another source. I think that would be wise. Well, we have faculty that have found ways to extract that from coal or coal byproducts. You name it, we have $418 million of this funded research supporting the curiosity of our faculty, but much of it is in the areas that most challenge Kentucky.